Many people think heart attacks happen suddenly, but they often send out subtle warning signs days before. These signs, like unusual fatigue or mild chest discomfort, can be easy to overlook. Ignoring these signals can be risky because they indicate that the heart is under stress due to reduced blood flow. Recognizing these early symptoms is crucial as it can lead to seeking timely medical help, potentially preventing a serious heart event. So, pay attention to your body. Those subtle hints could save your life. One of the early signs of heart issues is often not sharp pain, but rather a feeling of discomfort in the chest. This discomfort is frequently described as pressure, heaviness, or tightness, creating a sensation that something is sitting on the chest instead of a stabbing pain. It can occur during physical activity or emotional stress and may disappear with rest. Many people mistakenly assume that this mild discomfort is not related to heart problems, attributing it to muscle strain, indigestion, or fatigue. However, this type of discomfort could indicate that the heart muscle isn't receiving enough oxygen, a condition known as ischemia, which might happen temporarily before a more serious blockage develops. Additionally, the fact that this discomfort can come and go makes it easier to overlook. Individuals may feel fine one moment and slightly uncomfortable the next, but these recurring episodes can serve as important warning signs that should not be ignored. Unusual fatigue can be an early warning sign of an impending heart attack, and it's important to recognize it. Unlike regular tiredness, this fatigue can strike suddenly and without explanation. You might find yourself feeling completely drained even after a good night's sleep. Everyday tasks like walking or climbing stairs may suddenly feel like a major challenge. This happens because your heart isn't pumping blood as efficiently, causing a drop in oxygen levels throughout your body. As a result, both your muscles and brain receive less oxygen, leading to that overwhelming sense of fatigue. In some cases, this unusual fatigue can start days before a heart attack and may worsen over time. Unfortunately, because fatigue is so common, many people overlook it, chalking it up to stress or aging. However, if you notice this fatigue alongside other symptoms, it could be a sign that your heart is in distress and needs attention.
Sudden cold sweating can be a crucial warning sign before a heart attack. This sweating is distinct from the usual perspiration we experience due to heat or exercise. It often occurs unexpectedly even when a person is at rest, leading to cold, clammy skin that may appear pale. This unusual sweating happens as the body reacts to stress, particularly when the heart struggles or blood flow decreases. The nervous system activates a stress response, prompting the brain to release adrenaline and other hormones that prepare the body for emergencies, even in the absence of physical activity. Many individuals may also experience dizziness, nausea, or anxiety alongside cold sweating. This combination of symptoms can create an unsettling feeling, often described as sensing that something is not right. It's essential to pay attention to these signals, as they indicate the body is under stress. In some cases, cold sweating may occur hours or even days before a heart attack. Because these episodes can come and go, people might tend to overlook them. However, it is crucial to take repeated occurrences seriously and seek medical advice if they arise.
Shortness of breath can be a critical symptom that appears before a heart attack. Many people often link breathlessness to physical exertion, but in heart-related cases, it can occur even at rest. This sudden feeling of not being able to take a full breath can be both confusing and alarming for those experiencing it. The connection between shortness of breath and heart issues lies in how the heart and lungs function together. The heart is responsible for pumping blood to the lungs, where oxygen is absorbed into the bloodstream. If the heart isn't functioning efficiently, fluid can build up in the lungs, making it harder to breathe. Additionally, when blood flow to the heart is compromised, oxygen delivery throughout the body decreases, leading to feelings of breathlessness. Some individuals may even notice this symptom at night, waking up uncomfortable or needing to sit upright to breathe easier. Activities that were once simple, like climbing stairs or walking, may start to feel more strenuous. It's important to note that shortness of breath can have various causes, which often leads to it being overlooked. However, when combined with other symptoms like fatigue, chest pain, or sweating, it could signal a serious issue that requires immediate attention. One of the most underestimated warning signs before a heart attack is a sudden feeling of anxiety. This isn't your typical anxiety linked to everyday stress. It's a deeper, unexplained sense that something is wrong, almost like an internal alarm. Some people experience this sensation without any clear reason or visible danger, yet it persists and can be quite unsettling. This reaction isn't just in your head, it's tied to how your body responds to internal stress signals. When the heart struggles or blood flow becomes unstable, the nervous system picks up on these subtle changes. In response, the brain activates the stress response, leading to increased awareness, tension, and that nagging sense of unease. You might notice your adrenaline levels rising, your heart rate increasing, and your breathing becoming slightly faster. What makes this anxiety distinct is that it often appears suddenly and without a clear trigger. One moment you may feel perfectly fine, and the next, a wave of unease washes over you. Because there's no obvious cause, many people tend to ignore this feeling or rationalize it away, thinking it's just stress or fatigue. However, this unexplained anxiety can sometimes emerge hours or even days before a heart event occurs. Your body is reacting to internal changes that aren't yet fully visible or identifiable. This underscores the importance of paying attention to unusual emotional and physical sensations. Your body often communicates through subtle signals long before serious symptoms surface, and recognizing these early warning signs could be crucial for your health. Sleep changes often signal stress in the body, particularly before a heart attack. Many individuals notice issues like difficulty falling asleep or frequent awakenings at night. Sometimes they wake up feeling anxious or short of breath, which may seem minor but can indicate deeper issues. During normal sleep, the body recovers, heart rate slows, blood pressure drops, and the nervous system relaxes. However, if the heart is stressed, this recovery process can be disrupted, leading to restless sleep. The body's partial activation keeps sleep light and unrefreshing. Additionally, poor heart function can impact oxygen supply, altering breathing patterns during sleep. This can cause more awakenings and shifts between sleep stages, contributing to a restless night. Some may even experience vivid dreams or discomfort that makes deep sleep impossible. These sleep disturbances are common and often overlooked. People may dismiss them as temporary fatigue or stress. However, when combined with other symptoms, they could indicate serious strain on the body. One of the most misleading warning signs before a heart attack is related to digestion. Many people confuse heart issues with stomach problems, experiencing symptoms like nausea, fullness, or discomfort in the upper abdomen. Often described as indigestion, these sensations can lead individuals to seek relief through digestive medications, overlooking the potential heart-related origins. The heart and digestive system share nerve connections, meaning discomfort from the heart can manifest as stomach pain. Symptoms may arise after eating or even during periods of rest, creating confusion as they come and go. This unpredictability can lead to misinterpretation of the signals the body is sending. Additionally, these digestive-like symptoms rarely occur in isolation. They often accompany fatigue, sweating, or mild chest discomfort. Each symptom may appear trivial on its own, but together they can indicate significant stress on the heart. Recognizing this pattern is crucial for timely intervention. Understanding that heart-related symptoms can mimic digestive issues is essential for preventing dangerous delays in recognizing serious conditions. Awareness of these signs can save lives and encourage individuals to seek medical advice when experiencing unusual symptoms. One of the most misleading warning signs before a heart attack is related to digestion. Many people confuse heart issues with stomach problems, experiencing symptoms like nausea, fullness, or discomfort in the upper abdomen. Often described as indigestion, these sensations can lead individuals to seek relief through digestive medications, overlooking the potential heart-related origins. The heart and digestive system share nerve connections, meaning discomfort from the heart can manifest as stomach pain. Symptoms may arise after eating or even during periods of rest, creating confusion as they come and go. This unpredictability can lead to misinterpretation of the signals the body is sending. Additionally, these digestive-like symptoms rarely occur in isolation. They often accompany fatigue, sweating, or mild chest discomfort. Each symptom may appear trivial on its own, but together they can indicate significant stress on the heart. Recognizing this pattern is crucial for timely intervention. Understanding that heart-related symptoms can mimic digestive issues is essential for preventing dangerous delays in recognizing serious conditions. Awareness of these signs can save lives and encourage individuals to seek medical advice when experiencing unusual symptoms. Recognizing symptoms is just the beginning. Knowing what to do next is crucial. If you notice unusual symptoms, especially if multiple appear together, don't ignore them. It's important to stay calm, but act promptly. Awareness is your first step. Keep an eye on patterns like fatigue, discomfort, or shortness of breath. These deserve your attention. Reducing physical strain is also essential. If symptoms arise during activity, take a break to help your body recover. However, remember that resting alone won't fix the underlying issue. A medical evaluation is vital. Doctors can conduct tests to check your heart function and circulation, helping identify potential problems early. Early detection can make a significant difference, as many serious heart conditions can be effectively managed if caught in time. Lastly, avoid self-diagnosis. Guessing the cause of your symptoms without professional help can lead to delays in treatment. Trusting your body and seeking expert advice is the best course of action. The body often gives subtle warning signs before serious health issues arise. These signs can be easy to overlook, but they are crucial for your well-being. It's essential to recognize that the heart does not fail suddenly. It reacts to changes that develop over time. By staying aware of these signals, you can differentiate between danger and prevention. Ignoring unusual symptoms can be risky, but understanding how your body communicates can empower you to take action early. Ultimately, listening to your heart may be one of the most important choices for your health. One of the biggest challenges with heart attacks is that many people overlook the warning signs. Symptoms can creep up slowly and are often mild, making them easy to dismiss. A bit of fatigue, a slight shortness of breath, and an unusual feeling of anxiety might seem trivial at first. Individually, these signs may not raise any red flags, but together they create a concerning pattern. Unfortunately, people tend to attribute these symptoms to everyday issues like stress or lack of sleep, which can lead to dangerous complacency. Our brains are wired to avoid panic, often normalizing what we don't fully understand. Expectation also plays a significant role in this misunderstanding. Many people envision a heart attack as a sudden and intense event characterized by sharp chest pain. In reality, the body often provides quieter warnings that can be easily overlooked. When these warnings don't align with common expectations, they are frequently ignored. Recognizing this pattern is crucial for prevention. The body rarely remains silent before a significant event. It communicates through subtle signs that require attention. Being aware of these signs can make a vital difference in responding to a potential heart attack before it escalates. Recognizing symptoms is just the first step. Knowing what to do next is crucial. If you notice unusual symptoms, especially multiple at once, don't ignore them. Awareness is key, so pay attention to patterns like fatigue or shortness of breath that occur without clear reasons. It's also important to reduce physical strain. If symptoms arise during activity, resting can help stabilize your body. However, rest alone won't address the underlying issues. Seek medical evaluation, as doctors can perform tests to assess your heart function. Early detection can prevent serious conditions from worsening, and remember, don't self-diagnose. Always seek professional advice to ensure your health is prioritized.